Member for Saanich North and Islands.
You know, Mr. Speaker, my constituency inbox paints a much different picture than the one that the health minister is painting here and has been painting in this question period for months and months and months on end. My constituency inbox is telling a story of a broken healthcare system, Mr. Speaker, that is costing British Columbians more, and the outcomes are not being seen on the ground in our ridings. And I bet that every single member in this House, their email inbox in their constituency office is telling the exact same story. The amount of money that this minister has spent, from $21 billion when he became the minister in 2017 to $36 billion now, we should be seeing better outcomes, but we are not, Mr. Speaker. The seniors in my riding are being left behind. They're not able to access primary care. They're not able to get annual checkups. They're not able to get their prescriptions renewed. They're not able to inquire about developing concerns, Mr. Speaker. The emergency room at the Saanich Peninsula Hospital was temporarily shuttered overnight before it being indefinitely shuttered, Mr. Speaker. The question to the minister is, when is he going to open the emergency room in our ridings in Saanich Peninsula so that the constituents in my riding have access to health care when they need it?
Minister of Health.
Well, thank you very much, Honourable Speaker, and the members of the House will know that our public health care system has responded, I think, in exceptional ways in very challenging times. To say that we haven't had a COVID-19 pandemic, to ask a question while ignoring that, ignoring the fact that there have been, in the last 3 years, an additional 560,000 people who are registered with the MSP plan in BC, is ignoring the facts. And in the face of that, we have set records and are leading Canada in recruiting doctors, in recruiting nurses, in recruiting health sciences professionals, in recruiting healthcare workers, Honourable Speaker. We've expanded the scope of practice, for example, for pharmacists, Honourable Speaker. We've expanded the scope of practice for pharmacists, Honourable Speaker, that has brought care to hundreds of thousands of people. And, Honourable Speaker, we created new healthcare positions, expanding scopes of practice for associate physicians, people who are trained as doctors in other countries who weren't able to practice up to now, and in Saanich, for example, adding positions such as a new physician's assistant program, which we're engaging in the hospital. And so we are continuing, Honourable Speaker, in primary care, in seniors' care, to invest in the things that British Columbia needs, and we're going to continue to act in every community to support our public health care system.